Hello, I'm Joan Meyer. The Bridges to Health Home and Community-Based Waiver Program, also known as B2H, is designed to support children in their homes and communities. B2H serves children in foster care or Division of Juvenile Justice and Opportunities for Youth Community Services Supervision who've been diagnosed with serious emotional disturbance, developmental disabilities, and/or medical fragility. Once enrolled in B2H services, a child may continue to receive services even after discharge from foster care through age 21, as long as they are otherwise eligible. In this video, we'll be exploring the details of the Bridges to Health program. The video features an introduction and 6 chapters. This is Chapter 4, What are the services and how are they implemented? Part 5, Pre-Vocational Services, Supported Employment and Day Habilitation. The purpose of this chapter is to help you better understand the B2H program services offered so that you can better inform parents and caregivers and help them understand the benefits of the B2H program. You will also be able to help parents and caregivers recognize how their support is important in the provision of necessary services. Here to help us understand more about B2H and how it works is Isha Hines. Ms. Hines is currently employed at a healthcare integration agency. She has more than 10 years' experience in the child welfare field, working in group homes and as a foster care case planner. Isha, thanks for joining us. Individually designed pre-vocational and supported employment services prepare a youth with severe disabilities, aged 14 or over, to engage in paid work. Tell us how these services prepare B2H participants for work.
Sure. Pre-vocational services are geared towards facilitating success in any work environment for children whose disabilities do not permit them to access other pre-vocational services. This service can be provided on a one-on-one basis or in a group setting.
Okay. And what are some of the work-related concepts that are covered in these individual or group activities?
We want to make sure that the children are understanding how to comply with being in a work environment, understanding task completions. We want to make sure attendance, that they show up to work when they're scheduled, but also learn problem-solving skills and basically overall safety and learning the job requirements.
The goal of pre-vocational services is to prepare disabled youth to participate in paid work. The next service we'll discuss is supported employment services. Supported employment services provide assistance to waiver participants with severe disabilities as they perform in a work setting. Can you give us some examples, Isha, of supported employment services?
Sure. Supported employment services include job finding and development, working with employers and job sites, preparing them to be able to make necessary and reasonable accommodations, providing transportation information to and from employment, interacting with employers regarding the child's disabilities and needs related to his or her healthcare issues, and providing on-site support for the child as he or she learns specific job tasks.
Now, supported employment services may be provided in a variety of settings, particularly work sites. The last service we'll discuss in this chapter is day habilitation services. What is the purpose, Isha, of day habilitation services?
Okay, day habilitation services are designed to assist individuals with self-help, socialization, and adaptive skills necessary for successful functioning in the home and community. Any child that falls under the developmentally disabled category may access this service.
Give us some examples of some day habilitation services.
Some examples of day habilitation services include teaching personal grooming and cleanliness, bed making and household chores, learning how to use eating utensils and preparing food, social and adaptive skills, learning how to access and use public transportation, communication skills, and training in community locations, safety skills, money management, and informed choices.
Okay. Well, Isha, thanks so much for being with us. That brings us to the end of Chapter 4, What are the services and how are they implemented? Part 5, Pre-vocational Services, Supported Employment and Day Habilitation. In Part 6 of Chapter 4, What are the services and how are they implemented, we'll take a look at adaptive and assistive equipment and accessibility modifications.